Good afternoon, everyone. Bon après-midi, tout le monde. Got a few things to catch up on since we had a long weekend. Just globally, again, very quickly, we're up to 38.2 million cases. On est rendu à 38 millions cas mondial avec 1,087 000 décès, 1,087,000 deaths, 8,700. Let's put it this way: 1.1 million deaths worldwide. Sorry, I can't see straight. U.S. is leading with 7.8 million, with 215,000 deaths. Aux États, c'est 7.8 millions, avec 215,000 décès. Canada, we're getting cases. We're getting an average of 2,000 cases a day increase. Au Canada, depuis une semaine, on est rendu à peu près 2,000 de nouveaux cas par jour. Plutôt Colombie-Britannique, Québec, Alberta, et Ontario. And we're getting these increases across the board: Alberta, Quebec, BC, and Ontario, of course. In Ontario, we've had some increases over the weekend. Today's increase from yesterday was 746. The day before it was 807, and the day before that it was 600 and something. So we're kind of averaging at around 750 cases over the last 7 days. Donc, au niveau d'Ontario, les chiffres aujourd'hui, les cas ont augmenté de 746 depuis hier. Lundi, c'était et puis dimanche, c'était 807. Je pense samedi, c'était 650 à peu près. À la moyenne, depuis la dernière semaine, on est rendu à peu près 760 cas par jour à la moyenne. So in Ontario, like I said, now we're at 746. And again, the major areas are Ottawa Public Health 116, Toronto Public Health 311 cases, York 42, Peel 135, and then Halton, which is again a GTA 29. Donc, on a les cas plutôt, sauf à Ottawa, on a 116, mais les restants sont plutôt à la région d'Ontario, de Toronto, avec Toronto 311, 42 à York, 135 à Peel et 29 au Halton. Selon le cas que nous avons aussi 3017 décès. We've had 3,017 deaths in total since the beginning. Of note is that about 55% of the cases are less than 40 years of age. We're seeing small increases, hospitalizations as well, and ICU as well, so consistently going up. In terms of tests provincially, there's been 43,600 tests, when the positivity rate is 2.1% provincially, which is up from last week. Donc, au niveau des labos, on est rendu à 43 600 par jour, avec un taux de positivité de 2,1%, qui est plus que la semaine passée. Et il faut dire que à peu près 55% des cas positifs sont des personnes en bas de 40 ans. So let's now go to our numbers in terms of the health unit, and we've had our share of number increases this weekend actually. Here we go. So we're actually up to 105 active cases, and we've now at 360 cases, and that it breaks down as follows. As of yesterday, we've added a total of 31 cases since Friday. Yesterday we added, that includes 11 yesterday, which had 6 in Prescott Russell and 5 in SDNG. And today we added 20, 17 Prescott Russell, 2 in SDNG, 1 in Cornwall. Again, most of these are due to 2 current outbreaks that we have in congregate living settings. And I will talk a bit about that later. Donc, au niveau des cas, on est rendu maintenant à 105 cas actifs avec 360 cas. Nous avons ajouté depuis la fin de semaine, depuis vendredi, 31 cas. On a ajouté pendant la fin de semaine 11 cas, 6 à Prescott Russell et 5 à SDNG. Et depuis hier, on a ajouté un autre 20 cas, 17 à Prescott Russell, 2 à SDNG et 1 à Cornwall. Il faut dire aussi que la plupart de ces cas viennent des 2 flambées que nous avons actuellement, que je vais en parler tantôt. So in terms of the numbers and breakdown, again, I had shared with you last week our new case demographic maps. So our maps really have been modified now just to show you. We've got active cases, particularly basically all over our area. We've got these active cases in Hawkesbury are due to the outbreak in Prescott-Russell, and these active cases here are due to the outbreak in Alexandria at one of the homes there as well. So, donc au niveau des cas, vous voyez, on a des cas partout, mais on peut voir qu'on a 25 actifs à Hawkesbury. Ceci est un des foyers de longue durée, les résidences Prescott-Russell. Donc, on a 25 cas. Et nous avons 7 cas aussi à Alexandria au Palace, la maison de retraite Palace. 7 cas actuellement. Mais vous pouvez voir qu'on a des cas actifs partout. 6 à Cornwall, 8 à South Glengarry, et bien sûr, on a pas mal de cas proches d'Ottawa ici. So, just so I just want to break down now some of the numbers in terms of our outbreak. So we've had now 3 outbreaks going on. One is the one in St. Jacques, which should be finishing very shortly. But the 2 of note are as follows. We have one outbreak that was declared last week, over the weekend, at Residence Prescott-Russell, where actually right now we're up to 25 cases from that home that includes 17 residents and 8 staff. Donc, on a une flambée qui a commencé en effet vendredi pendant la fin de semaine. On a jusqu'à date 25 cas, 17 résidents et 8 personnel. This started as an outbreak, a respiratory outbreak. We tested symptomatic individuals on a certain floor, and then some came back positive. Subsequently, we've tested everybody. We're waiting for the rest of the results. La flambée a commencé avec une flambée respiratoire. On a fait des tests sur un étage. Nous avons trouvé quelques cas positifs de COVID. Et finalement, on a testé tout le personnel et tous les résidents. On attend encore les résultats. Donc, aujourd'hui, on a reçu d'autres. C'est pour ça qu'on a ajouté aujourd'hui tant des cas. And in terms of the other home, which is it's a retirement home, it's the Palace retirement home, and then again there was we had 7 residents that tested positive, and all residents and staff have been tested. They had some symptoms, and we're monitoring that situation as well. We are providing support as needed for any infection control or anything like that. La maison de retraite Palace avait 7 cas positifs, 7 résidents. Aussi, on commençait avec une qui était symptomatique, donc on a déclaré là-bas. Là, on a testé tout le monde dans cet établissement et on attend les résultats encore. In terms of support, obviously, we have a plan that we've been sharing with our hospitals and our long-term care facilities and other congregate living settings where we score them and we kind of figure out what their needs are, and particularly during an outbreak, if they need any support or anything like that. So we do have access to the hospitals. Both the Hawkesbury and Alexandria hospitals are available to help out any of those 2 homes that are in outbreak. We have right now, as you know, there's been a offer by the Red Cross to essentially offer support, and this we don't have any details of this. I know I've got a lot of questions of this, but I know that the federal government is sponsoring this, and the Red Cross is in the process of working with the Ontario government to identify homes, which homes would be. In our area, it would be homes that would be an outbreak that may need the help. Again, nothing's been organized in our area, or no home has been officially targeted yet, or details have been worked out with. I know that the ministry has told me that those details are forthcoming. Donc, au niveau de support qu'on donne nos foyers et nos résidents de retraite, nos maisons de retraite, en effet, nous avons toujours une liste avec laquelle on travaille, en collaboration avec nos hôpitaux pour offrir l'aide au niveau, surtout quand on a une flambée dans une de ces foyers. Cette fois-ci, c'est la même chose. On est en contact avec les hôpitaux pour les aider. En effet, la Croix-Rouge avait offert à travers du gouvernement fédéral de rentrer aux maisons de longue durée. On part en Ontario et on a ciblé, on a pensé que Ottawa, parce qu'on a, je pense, 5 à 6 maisons ou 7 à Ottawa, nous avons quelques-unes, sont potentiellement des places où la Croix-Rouge pourra aller aider. Par contre, j'ai confirmé aujourd'hui avec le ministère d'Ontario que les détails ne sont pas encore faits. On n'a pas de détails encore exactement. On n'a pas choisi de façon officielle quelles maisons ils vont visiter, etc. Donc, on attend toujours les détails sur ça. So that's where we are with that. In terms of the testing, I'm going to give a bit of an update just as a sort of a general information to you. Pharmacies in Ontario, as you know, there's about 60 of them that are now providing asymptomatic treatment. They're testing about 1,400 people a day, and their positivity rate is 0.3%, very low positivity rate. We were told that 100 more pharmacies are coming on board. I'm hoping some will be in our area, but I'm not sure yet. We haven't been given that list. Donc, au niveau des tests, comme vous savez, on a à peu près 60 pharmacies en Ontario qui offrent des tests pour les personnes qui n'ont pas de symptômes, mais pas dans notre région encore. Mais par contre, la moyenne, ils testent à peu près 1400 patients par jour. Et le taux de positivité est vraiment 0,3%, très bas. Mais on attend une autre centaine de pharmacies de commencer à tester. Espérons que ça va être dans notre région, mais je n'ai pas de détails encore. In terms of our tests, we're now up to 62,926 tests that we've done in our testing centers. Hawkesbury, 9,581. Cornwall, 14,295. Winchester, 10,633. Castleman, 21,047. That includes some of the Limoges ones. Rockland, 6,061. EMS Prescott Russell, 169. And EMS STNG, 330. Donc, au niveau des tests qu'on fait, on a complété 62 926 tests de fait dans nos centres de dépistage. Et ceci inclut à Hawkesbury 9 581, Cornwall 14 295, Winchester 10 633, Castleman 21 047, Rockland 6 061, EMS paramédic Prescott Russell 169 et les paramédics de SDNG 330. We're also a few other things I just want to talk about in terms of our school outbreaks. We have not had any new ones since I last reported on Friday or new cases. Donc, au niveau des écoles, rien changé depuis vendredi, depuis la semaine passée que on a eu le même numéro de flambée 1 et des cas dans les écoles ne sont pas augmentés. Just to know, we're also waiting for some Halloween guidance documents from the ministry. We're also waiting for some Remembrance Day documents. And today I was asked about Christmas and parades. And again, that's going to be looked at the provincial level for some kind of guidance. So those will be forthcoming. Donc, au niveau des guidances pour Halloween, même Noël, on est en train de faire les guidances, les documents de guidance. Et sous peu, on va les avoir. Donc, on va attendre pour ça. Mais je pense que pour Halloween, on va l'avoir d'ici la fin de semaine, cette semaine. OK, donc, I have a few questions here. J'ai des questions pas mal que j'ai répondu au niveau de résidence Prescott Russell. En effet, c'était les personnes qui étaient symptomatic, c'est pour ça qu'on l'avait testé. So the questions really were, I've answered a lot of them in terms of the cases, and we're still waiting for more because we've got the results back, but we haven't got all the results yet. I have a question here from Nick in terms of gyms. In our area, the gyms are not affected by the stage 2 sort of reboot that Ottawa, Toronto, and Peel did. We're still at 50 people, up to 50 people, but have to be fit, presuming that they have physical distancing, and they should be wearing masks except when they're exercising. Le droit me demande au niveau de Croix-Rouge. J'ai répondu à Croix-Rouge. Il y a une autre question parce que à cause que les restrictions sont à Ottawa, par chez nous, est-ce qu'on a eu un afflux des gens venus d'Ottawa dans l'Est ontarien le week-end dernier? Mais on a eu quelques plaintes et puis on observe ça de façon prudente. J'avais déjà parlé avec les deux présidents, le warden, Leroux aussi. Et aussi, on a décidé vendredi, quand on a dit de ne pas le mettre dans notre région. I just want to digress a bit and talk a bit about the stage 2, modified stage 2 that Ottawa and Toronto and Peel were in. And we looked at those numbers. I had meetings with our wardens and the mayor of Cornwall as well about this. And we really looked at, we took a tick list and ticked off where we had cases in our area, and we really didn't have at that point cases in restaurants or in gyms or areas that were sort of affected by that. And so we really found it was a bit challenging to see what decision we would make. So what we had figured at that point, we said, well, let's see, keep a close eye on the numbers, see where we are with that, and we'll keep status quo and not affect it, knowing that we may have an influx from Ottawa. We had a couple of complaints about people going to Ottawa restaurants, and we're getting a lot of hockey teams trying to book ice in our area, but actually from Quebec as well. And I had recommended to our municipalities not to do that because we want to avoid interregional travel. So that's why we made a decision. Now, we are looking closely at our numbers. Like I said, we're looking closely at the numbers that went up dramatically over the weekend. Again, most of them were due to the outbreaks. However, we do get the odd case where we know that it came from visiting Montreal or a contact and so on. But at this point, because the numbers are going up, our positivity is going up in terms of that. So we will be keeping a very close eye on that. And I know that the government is looking at that provincially as well, looking at regions, looking at trends and patterns. So that's something that we'll be looking at very closely. Got another question here. I added a section 22 order. I didn't add a section 22. I just changed it. It was for restaurants. So just to clarify that people required masks, even in patios. Servers needed rules to clarify that. I just added that, so I didn't do much more on that one. We're modifying them because our orders talk about a 14-day period of isolation for if you're positive for COVID. But now the new studies have shown that you need a 10-day isolation. So we're just modifying those. So stay tuned, we'll be modifying those as well. There's a whole slew of them that we need to modify because we've included all those in the orders for businesses and so on for how they handle their staff. A question about flu availability. The flu shots, we're getting supply. We're already starting to distribute it to long-term care facilities. They will be available to all our offices. Flyers have gone out. Campaigns will go out, and we are expecting an increased uptake. We are working with area physicians as well. So I do believe that those will be, we will have an increased uptake for vaccines, flu vaccines this year, and we are encouraging it so. And we will be offering it at all 6 of our offices. And again, they're available in pharmacies as well, and they're also available at select or participating healthcare providers across our region. So that's it for now, and I will take some questions. Je vais prendre des questions.
Thank you, Dr. Paul. Our first question comes from James Morgan, The Review. Please go ahead.
Good afternoon, Doctor.
Hi, Jim.
My question is, it's kind of a contact tracing related item, I guess. We know how how COVID was introduced to Prescott Russell residents. If it was a respiratory outbreak that became COVID, could it have come in through an employee or a visitor?
Well, that's what we're trying to find out. We're trying to see how it got in. It got in somehow. So we don't know yet. We're doing the tracing right now. We don't know. At this point, we just want to ensure that we tested everybody and that we had all the precautions in place, disinfection and so on. But we are looking at that. We're trying to trace it. Sometimes it's hard, but that's something that crossed my mind. That was the first question I asked myself.
And similar question, I guess, for the palace there at Alexandria.
That as well, we're not sure. We're looking into that as well. At this point, we only have residents that are positive. We don't have any staff that are positive.
Okay, thank you.
Thank you.
Our next question, Dr. Paul, comes from Philip Blanchet, the leader. Please go ahead.
Hi, Dr. Paul.
Hi, Philip.
So I know you already touched on about people coming into Ontario from the red zones in Quebec. Can you elaborate a little more about what's being done, though? Because I know here in South Dundas, there were some people that had traveled from Quebec. There were Quebec plates spotted in shopping here in town, which, of course, makes some local people upset because they know what's going on around. And then also coming from the Ottawa area down, like from the Outaouais and that. So if you just maybe expand on like what's being done to try to stop that either at the border or what contacts you've made to try to get some action on that, in part just to kind of, quell people who are local who are seeing this and are worried.
I understand their worry. We have, first of all, provincially, there's been a strong recommendation for people not to travel from zones, particularly from high risk zones to lower risk zones. So that would be for Ottawa and those areas. For Quebec, it's a chronic problem. I've actually got a call in for Jim McDonnell to see what we can do. Again, it's not my decision, but it is something that I will be bringing up. I don't have the power to block it. But I do know that in Quebec as well, they're told not to travel and travel outside their zone. So it is a challenge, and I will be calling. I actually want to speak to Jim McDonnell this afternoon just to see what we can do. As I was told that this has to come from an interprovincial type of approach. So it's a province-to-province approach. But I do hear you, and I share the frustration as well, because we're trying to tell people stay where you are, stay home. Don't. And I could see where the fear is.
Okay, thank you.
You're welcome.
Our next question comes from Denis Babin, Radio-Canada. C'est à vous?
Bonjour, Denis.
Bonjour, Dr. Paul, vous m'entendez?
Oui, oui.
Oui, Dr. Paul, pour revenir à la question de James qui a été posée en anglais, simplement me dire où ce que vous en êtes rendu, où on en est rendu avec l'enquête à la résidence Prescott-Russell. Et deuxièmement, on parlait évidemment du portrait incomplet parce qu'il y a des résultats de tests que vous attendez toujours. Alors, me donner le nombre de résultats qu'on attend toujours à la résidence.
Écoutez, nous avons, merci Denis. Premièrement, j'ai dit qu'on a actuellement 25 de cas positifs, 17 qui sont des résidents et 8 sont des personnes qui travaillent là-bas. Nous avons testé, en effet, il y a 125 en total résidents. Et je ne sais pas le chiffre exact des personnels que nous avons testés, mais on entend à peu près la moitié de ce test à retourner. L'autre question était où on a trouvé l'enquête. Jusqu'à date, on n'est pas sûr de comment c'est rentré, mais c'est sûr et certain que le plus que le virus propage dans la communauté, le plus facile que ça va rentrer, soit aux maisons de longue durée, ou aux maisons de retraite, ou en école.
En fait, donc, ce que vous disiez, c'est que dans les 300 personnes qui ont été testées, employés et résidents, il y en a la moitié qui sont rentrés jusqu'à
Non, pas 300. Il y a à peu près 125 résidents, je m'excuse.
Non.
125.
Oui, mais si on compte les employés.
Ah, OK, oui. On a la moitié à peu près. Oui, c'est ça.
Parfait.
Merci, Dr. Paul. The next question comes from Nation Valley News. Please go ahead.
Oh, hi, Doctor.
Hi.
I was just wondering if you could clarify when the standard self-isolation period will be dropping to 10.
It's already there. And that is, let me clarify. You have to isolate for 10 days if you're positive or you have COVID symptoms. If let's say you came into contact with somebody who had COVID, then you have to self-isolate for 14 days. Different thing, okay? Because if you're in contact with somebody, it can take up to 14 days for you to develop it. Once you have it, you're not contagious after 10 days. I know it's a bit confusing. That's why I have to repeat it many times when it first came out, so I'll explain it to people.
Okay. I had kind of an unrelated question, but does the NAV Center still figure into pandemic planning in this area? Because there was an MPP made a bit of a splash talking about Public Works Canada's procurement of some kind of centralized quarantine facilities. And it's not totally hypothetical, because the first cases we saw, or feared cases that we saw in Canada, were in fact detained in centralized quarantine facilities, one of them being in your jurisdiction.
Yeah.
Are there plans for expanding that kind of a thing if things get really bad?
Yeah, there's a couple of things. There's plans for quarantine, not necessarily NAV Center, but we always have plans of where will you put people in quarantine. Let's say there's a big household, you want to quarantine people like they're doing in Toronto. So there is a plan for that. But there's also a plan for looking at hotels and premises like NAV Center to be secondary hospitals. You know, where let's say you had a surge of hospital admissions and you wanted to transfer out non-serious patients or non-critical patients. That's another way. So there's two roles to those type of premises.
Okay, thank you.
Okay.
Moving to the phone lines now. Do those joining by phone have questions? Ceux qui se joignent par téléphone ont-ils des questions?
Stéphane Bourgeois from the Regional Hawkesbury. I was wondering if we could talk a bit more about the Hawkesbury Prescott Russell residence situation. I was wondering what would be needed for Prescott Russell to be identified as qu'est-ce qui nous amènerait la Croix-Rouge à Hawkesbury?
Ça sera vraiment l'aide pour la demande. On pourrait le demander. On est toujours au courant que non seulement à Prescott Russell, les maisons de longue durée ont la difficulté à avoir le personnel pour donner les soins ordinaires, personal service, tout ça. Et donc, si on attend le processus, mais si disons que on constate qu'on a besoin de l'aide, qu'on ne peut pas donner ou c'est pas assez l'aide qui va être donnée par l'hôpital, par exemple, à ce moment-là, on va demander au Croix-Rouge de venir aider parce que ça prend beaucoup plus de personnel. Premièrement, il y en a 8 déjà qui sont positifs, qui ne pourront pas travailler. Et aussi, ça prend un peu plus de façon étroite, ça prend beaucoup plus de précautions. Les personnes doivent manger dans leur salle. Donc, ça prend un peu plus de personnel pour supporter une maison comme Prescott Russell, surtout pendant une pandémie, une occlusion. Donc, c'est pour ça qu'on aurait besoin de l'aide personnelle, l'aide humaine pour prendre soin des personnes et aider aussi aux précautions d'infection, contrôle d'infection, etc.
Oui. And I was also wondering if the home itself could do something to prevent the spreading from inside.
Yeah, exactly. This is exactly what they're doing. This is exactly the protocols that I'm talking about. When we have an outbreak, there are protocols that are brought up where you limit travel from one floor to another. You isolate residents in one area. You don't let them. You know, there are a whole slew of things that are being done, including disinfection and so on. But it's not only that. It's including it's PPE. It's control of movement. It's control of transfers. It's a whole slew of things that occur. So it's not just one thing. And of course, that's part of the goal is to try to contain it as much as possible.
Yes, and lastly, est-ce qu'on peut voir, est-ce qu'on verrait d'autres restrictions en ce sens-là en termes de visite ou de sortie des résidents?
Mais premièrement, à cause que c'est enflammé, tout est vraiment gelé. Il y a certaines choses qu'on va avoir dorénavant parce que déjà, ils ont changé un peu les limites de visite. Et c'est sûr et certain qu'on va voir au niveau de quel type de visite qu'ils ont, mais ce n'est pas, it's not business as usual. Okay?
Yes.
Thank you, Dr. Paul.
Welcome.
Do others joining by phone have questions? D'autres questions par téléphone? We do have one more in the chat box, Dr. Paul. Julie Ireton, CBC News, please go ahead.
Hi there. I'm just wondering if you have any concerns about how long it took to get the results for the residents, Prescott Russell. over the weekend? I understand that tests were done on Friday and they only got results today. And I'm just wondering if the home was able to isolate in the meantime and that kind of.
Yes. The home isolated anyway. We presumed everybody was positive until we got the test. So to me, it doesn't make a difference how quickly we get the results. We had isolated, we had tested everybody, we had done the precautions. To me, it didn't make that much of a difference. Of course, I don't want many people to get infected, but no, we got it. And as we wait, we do not wait for the results. We presume they're positive until proven otherwise.
Okay. And did your office call in the Red Cross, or
No.
who
No.
would have added it to the list that would require
No.
help?
What happened was and I spoke to the LIN about this, the Ontario Health people. They looked at some of the homes that discussed with us last week, theoretically, before even an outbreak, which homes would need help. And some of them were on the list. We really didn't request it specifically. All I know is that what we do is whenever there's an outbreak in a home, we always look at what their capacity is in terms of staffing, what their needs are, so we can see what help we can provide them through our hospital partners.
Thank you.
You're welcome.
Those are all the questions for today, Dr. Paul.
Thank you very much.